Hi everyone, Nicole here. Before we jump into the video today, which you will very quickly find out is not the live that I did this morning, and I'll get into those reasons, I just need to preface the rest of this conversation by very clearly stating I'm not a lawyer, I'm not a legal advisor, I'm not a medical advisor. I am not speaking on this topic as a credentialed member of either of those communities. I am speaking as a citizen, as a member of the public who walked into a hospital, was hurt by the hospital, and followed the system as far as I could through internal complaint and feedback mechanisms, through legal channels, and into the insurance channel, which ultimately led me to the Office of the Superintendent of Insurance. This is strictly my personal account, and I highly encourage and recommend, if there's anyone in the comment section who has a story they want to share, has an experience they want to share, has perhaps professional experience that can expand this conversation, I think it's really important. Consider this a conversation with a layperson, someone who's doing the best they can with the information that they could find, using the experience that they have working in the legal and financial world when it comes to corporate administration, digging for documents, understanding process and liability, because I have worked in the legal sector, funds and fiduciary, and insurance. So I'm looking at this as a bit of an insider, but yet still a layperson when it comes to the mechanics of the actual law. I'm just doing the best I can with what I have. And hoping that my tenacity and audacity may also inspire you to dig a little deeper if you find yourself in a similar situation like I did. Anyway, without further ado, on to the video. So, I did an entire live today, and no one can hear it. I forgot to disconnect my earbuds, which were on the other side of the room, and it was attempting to pick up that microphone. And I'm very sad. I'm very sad because I was talking about a really important topic for me, which is what happens when you walk into a Nova Scotia institution, aka a public hospital, and you get hurt. And the long and the short of it is, as a member of the public, when you walk into a public hospital, you are not considered an insured party from a liability standpoint. So what does that mean? It means if you go into the hospital and you get hurt, the only recourse that you have is to file a lawsuit in the Supreme Court of Nova Scotia. If you attempt to go through the feedback and complaint channels inside of the hospital, your complaint is converted into a shielded private matter that you as the complainant don't have access to, nor are they required to disclose remedy or any other details that might be part of the investigation. If they deem your case to be risky enough, they fire it off to the legal counsel, who then is required to bring it to their insurance company. The insurance company, in the case of the IWK, is the Health Insurance Reciprocal of Canada. And reciprocals do not operate like traditional insurance companies. They are pooled funds that work kind of like a co-op, and the risk gets spread across all of the institutions that participate within that particular reciprocal. Now, in the case of the IWK, the external counsel that represents the IWK is also the same counsel that represents the insurance company. And it becomes really tricky when you start attempting to engage them and speak with them, because they don't like to be very clear on who they represent. They try and keep it ambiguous. nor will they provide you any information related to the insurance file that apparently has been opened based on the claim. In my own personal case, I ended up taking my matter, because I couldn't get resolution through the lawyer who happened to represent both the insurance company and the hospital. I took my matter to the Office of the Superintendent of Insurance in an attempt to get information on what my file number was, who was responsible for it, and who was a representative that I could speak to. And ultimately, the Office of the Superintendent of Insurance sent me back to the lawyer that I wasn't getting anywhere with, because according to the Health Insurance Reciprocal of Canada, I, as a harmed party inside of the hospital, am not considered an insured party, and therefore they have no legal obligation to speak to me. Do they have a moral and ethical? Absolutely. Legally, do they have to? No. There's no legal requirement to compel an insurance company to speak to an injured party in the absence of a claim filed with the Supreme Court of Nova Scotia. So from a public health standpoint, what does that look like? Well, it looks like, as the public, your money, your tax dollars, are going into funding the operation of the institution. Through that operation, they are paying their insurance premiums, they are paying their external counsel. When something happens, they either attempt to offload the risk onto the clinicians, the practitioners, the nurses, and tell you that it's actually medical malpractice because they don't want to take accountability and responsibility for the conditions that their staff work inside of. And when that doesn't work, when you don't really buy that story that all liability sits on the clinician, that they do share some accountability and responsibility, the system throws up all the walls and says, sorry, if you want to get anywhere with us, you're going to have to sue us. So then you have to go into the justice system, which your tax dollars also fund, while also hiring a private lawyer to try and litigate something on your behalf against lawyers that already have your complaint because it's been shielded, that represent both the hospital and the insurer. The cards are completely stacked against you. And even though you entered the system with a provincial health card, you're still not considered an insured party, because that provincial health card, which in the case of Nova Scotia is administered by Medavie Blue Cross, is simply like a debit card to pay your way through this public system. So you're paying for the health card, you're paying for the hospital, you're paying for their lawyers, you're paying for their insurance, you're paying for the justice system that you now have to privately fund your way through to attempt to get any resolution, accountability, and responsibility from the institution. And then at the same time, the foundation for the hospital, the IWK Foundation, is holding out their hand saying, please give us some money to help us provide you better care. We have a problem. We have a big problem in the province of Nova Scotia. And if we're attempting to fix and solve our healthcare issues, either inside the legislature, which, quite frankly, they would have to tackle this insurance industry, or this insurance issue, because the Office of the Superintendent of Insurance is regulated by the government, and it is the Office of the Superintendent of Insurance that licenses the Health Insurance Reciprocal of Canada to be able to operate in the province of Nova Scotia and therefore represent institutions like the IWK. They need to be held accountable for the liability coverage that they are offering inside of these publicly funded institutions, where the public is walking through the front door uninsured from a liability perspective. Try driving on the road without insurance and see what happens. But yet you walk into a hospital in your most vulnerable state as a member of the public, where you can be hurt and you're not insured and you're not considered an insured party. We have a problem. So this is a 7-8 minute synopsis of the conversation that I had this morning. Unfortunately, that I can't play. But this is a conversation that I want to keep having, because I think it's really, really, really important that we as the public stop outsourcing all of our accountability and responsibility and autonomy and authority and agency into third parties like the government, like the health system, like lawyers who can't show us what's actually happening under the hood. Because if the only way you're looking for recourse from a hospital when you get hurt is to hire a malpractice lawyer and sue the doctor, well, then that keeps creating bigger issues that we have inside of our health system, which is that as a doctor, I'm not necessarily going to care for my patients in the way I feel I should or the best way possible if it leaves me open to potential lawsuits. This is how defensive medicine starts getting practiced instead of health and wellness. Specifically, when the institutions they're working inside of are subrogating and offloading all of their accountability and responsibility for their policies, procedures, governance, and operational management onto the people that are working inside of those spaces. It's a big conversation, and it's one that I think that we have to have, because I don't see in any world where we have any semblance of reform inside of a health system if we don't change the way we participate. And we change the way we participate by changing how we show up, how we notify them of harm, how we track it down, and we stop making it so easy for them to hide inside of these shielded processes. And we hold the government agents responsible. In Nova Scotia, it would be the leader of the opposition party, Claudia Chender, who wants to, in this moment, lead a coalition or lead some sort of organized movement with the Department of Health and Wellness to support women and women's health in response to the IWK Foundation's Women's Health Initiative. How are you going to fix women's health if when you walk into a hospital and your consent is breached and trust is breached and there's absolutely no way to get any accountability and responsibility inside of the institution? Well, the women who aren't already seeking care because they don't feel heard and they don't trust the system that they're being asked to go into, the education that is now unfolding in an attempt to funnel women into a system to try and convince them to trust the system, that inevitably, when they get hurt inside of it, have to emotionally, mentally, physically, and financially fund their way into remedy because no one wants to be accountable. We have to do better. We have to do better. And it starts with each of us individually, learning how to take accountability and responsibility for the questions that we ask, and the steadfastness in which we don't just take their word for it. Keep pushing, keep asking, keep attempting to move the needle so that we can, hopefully, collectively, make enough organized or create enough organized pressure that the written documentation, the records that are being created through email correspondence, through their own admission, becomes too powerful to ignore. I hope this made sense. I hope you have a beautiful day. I'm going to try again next Tuesday to go live and remember to turn off the earbuds. But in the meantime, thank you for being here with me, and I'll see you soon.